Hello and welcome to the Health Channel, all health all the time. I'm Laura DeAngelis coming to you from the Baptist Health South Florida studios in Coral Gables. Well, can you believe this one? Kim Kardashian West spends $4,500 on her skin care routine. Wow, okay, well, she does look pretty good in that picture, but you know what? For the next hour, we're going to learn how us non-celebrity types can put our best face forward each and every day without necessarily breaking the bank. And joining me in the studio to help us break down some skincare basics is Dr. Ileana Perez-Quintaros. She is a dermatologist with Baptist Health South Florida. Doctor, it's wonderful to have you with us. Thank you for being here.
I am so happy to be here. Thank you. Thank you very much.
Absolutely. Now, Dr. Perez, we know no two faces are the same, of course, but let's talk about the skincare essentials that everyone really should be focusing on.
Yes, definitely. Everyone really needs to focus on cleansing the skin well,
Yes.
on a sunscreen and a moisturizer. Those are really the basic things that we need. And then there's a lot of add-on type products that we can throw into that regimen. But the basic things, cleansing, sunscreen, and moisturizer.
Okay, so basics are good, and we actually put together a list of some of the other things that we think our viewers might need, but of course we're going to want to take a look at that and then see how you think it stacks up. So we're thinking that on every day, like you said, cleanse, use some sunscreen. Also, staying hydrated is important. Eat well, and for all the ladies out there, and I know I'm guilty of this sometimes, you know, be sure to remove that makeup at the end of the day. So again, doctor, what would you like to say about some of those extra items on that list?
So we definitely have to cleanse our skin, and we should use a sensitive skin type of, or actually a mild cleanser. We don't need to scrub the oil and dirt and pollution off of our skin, but that's the purpose of a cleanser, is to take those things away, but you want to do it gently. Doing it too aggressively is going to cause perhaps irritation. It's going to make you more susceptible to inflammation, so we don't want to do that.
Okay.
So moving on, we do want to always use our sunscreen. Sunscreen is going to be one of the basic requirements of skincare. We do know, proven beyond a doubt, that ultraviolet radiation causes aging, changes in pigmentation in the skin, right. Wrinkles, all kinds of things we really don't want. Sun is good for us to some degree. It does build up our vitamin D, but yes. we do want to limit it. Okay. So that's the first one's cleansing, sunscreen.
Okay, and the good news is you actually have some ideas for us here when we talk about cleansing, like you said. What are we basically looking for as far as a cleanser goes for our face? And I guess a big way to start that is it ever okay to use soap on our face? So let's talk about that.
So as long as the product is mild, it's appropriate for cleansing. There's different kinds of complexions. So for example, if you have normal skin, you can use most of the products that are out there but always mild products.
Okay.
If you have sensitive skin though,
right.
you do want to focus on products that are labeled for sensitive skin. These products do tend to be a little creamier. They tend to not create a lot of foam, but they do leave a little bit of a moisturizing quality on the skin. They are not a moisturizer, but they do remove the pollution, the oils, and the dirt from the skin. If you have oily skin, however, we need something that has a little bit more of a surfactant. That is the chemical that will break down the oil. We need a little bit of that in the product. So you're going to look for products that are labeled for oily skin.
Okay, and doctor, can you just refer us here? I think we have a cleanser here, so you just want to
correct.
Kind of
so we have a group of cleansers here. Some of these are for sensitive skin, and
okay.
others are more appropriate for patients with, for example, oily skin, acne-prone skin. The sensitive skin cleansers are going to be appropriate for just about everyone.
Okay.
And we've got a couple of examples here. For the woman with a little more years under her belt,
okay.
you might want to use one of the products that are more that are for anti-aging purposes.
Okay, that's good to know. And again, speaking of the sensitive skin, is there anything if we are, say, in our local drugstore, is there an element in the ingredients that might be a warning sign, like my skin is too sensitive to handle this particular ingredient?
So you want to be careful for sensitive skin. You want to be careful with products that are labeled that they have an acid in them. So for example, products for cleansing acne-prone skin.
Okay.
Those are going to have harsher ingredients in them. Products that are labeled for oily skin, you want to stay away from those. So for sensitive skin, you want to stay with products that are labeled as sensitive and mild.
Okay, good to know. Now, again, let's move on to sunscreen. And we just mentioned, of course, sunscreen, especially here in the sunshine state, very important component to our everyday skin routine. We do need some vitamin D. We know that it is good for us, but we don't want to be open to the risk of skin cancer. And so, doctor, I know you also have a couple of sunscreen examples here. And tell us again, what do we look for in a sunscreen? What is the SPF we need?
Okay, so that's we can probably spend the entire hour
We could, yes,
on
I'm
this
sure.
one, and we have a whole array of sunscreens here.
Great.
But we're going to sort of try to break this down for you.
Okay.
So daily sunscreen. Daily sunscreen is highly recommended. Here's a few products here. We have the ones that do not have tint, and we have those that are tinted.
Okay.
So women, myself included, sorry, we love the tinted sunscreens. We don't have to use a base, a foundation base sometimes. So
Perfect. Skip one little
skip
extra.
one step.
Exactly.
There's too much to do.
Yes.
So you always want to use your sunscreen. What number do you want to focus on? We, as at our organization as dermatologists, we like everyone using an SPF of 30 for daily use.
Right.
So 30 or higher. The previous recommendation used to be 15. But we found that the sunscreens that had an SPF of 15 did not really give us enough UVA coverage, and that's important also. We want UVB coverage and UVA coverage. So SPF 30 is what's recommended. There have been some recent studies, though, that we should not shy away from the SPF, the higher SPFs, like SPF 100, for example. If we're going to be out in the sun for prolonged exposure, you do want to use the higher SPF sunscreens. They will provide more. They will provide coverage for less damage to the cells. And then there's different kinds of sunscreens.
Okay.
So for example, that you can use for outdoor exposure, for body protection.
Right.
The sprays, great.
Very
option.
convenient, easy to use, right?
Lotion sunscreens, cream sunscreens for sensitive skin. So
Okay.
we have sensitive skin sunscreens. We have the oil-based sunscreens. Sprays is one of the categories I want to cover, because sprays are great for body application, but that does not mean you spray it on and leave it there. You do have to rub it in to get that coverage.
That's a very important point, doctor. Thank you.
Stick sunscreens, excellent, wax-based. These sunscreens are great for the face, and when you're going, you're going to be sweating. So, for example, sporting. If you know that you're going to be sweating, riding a bike, and you're going to be sweating quite a bit, the wax sticks are great because they do not affect the eyes. They don't drip into the eyes. They stay in place. So that is a great quality for these.
Okay.
And we have a whole host now of all kinds of sunscreens that function as makeup. So we actually have lip gloss that has sunscreen in it. This lip gloss, I believe, has an SPF of 30, 35.
Wow.
We actually have powdered types of sunscreen. So this one, the interesting point here is that facial powder sunscreen for women, you can reapply that. So prior to these types of sunscreens, we really didn't have something that we could reapply in the middle of the day. So, for example, working women, we have our makeup on. We're not going to take our makeup off in the middle of the day to reapply the sunscreen. The powdered sunscreen, you just brush it on, and it gives you some added protection. This particular one gives us actually an SPF of 50. So that's excellent. We have the primer type sunscreens, help the makeup, help the makeup go on better.
Thing, right.
Some women really appreciate that. And then we also have the compact type makeups, which give you a nice coverage, nice SPF, and we don't have to apply a base. So again, taking out one of those steps that you have to take in the morning in order to get to work.
Yeah, and you know something, with so many different options, we really don't have an excuse not to use sunscreen at this point. Honestly, I didn't really know about the powders until you brought them here today, so it's good to know. One other question about makeup though, doctor. There are some makeups that are out there. You can buy them in a local drugstore and they have SPF in them. So what do you say to women who are putting those on a daily basis? Are they okay for just limited sun exposure, getting in and out of the car, and when are they not enough? What,
yes.
you know?
So they're excellent. So at least if we use those on a daily basis, that's something. But we have to understand that I don't think many of us actually apply our sunscreen as our makeup as thickly as we do our sunscreen.
Right.
And that is the way that the SPF is calculated. It has to be a relatively thick layer with plenty of coverage in order to actually have that number of SPF coverage. So it is, if you're able and you really want to be diligent, we do recommend that you apply a regular sunscreen first with the SPF that's recommended, which is an SPF of 30, and then put your makeup on. A lot of makeup also doesn't have a high enough SPF. Many of them have SPF 15. That's not enough.
Okay, that's good to know. And Doctor, we're actually going to get a little bit more into this as we go further on the show, but I want to show our viewers all of the array of products that exist as extras, if you will.
There's
you
a
brought
lot
a
of
lot. So here we are, we're looking at that array, and again, there's a lot there, and we do want to talk about a couple of these when we move on in the show. But for now, we just got started out with the sunscreen and the cleanser, and when we come back, we're going to find out more about how to take care of our skin, what really works. And check out our website, allhealthallthetime.com, whenever you feel like it. Stay with us.
The Ultra G can be used for everything from athletic population, from young kids, high school, college, professional athletes, all the way to our older populations coming in with hip replacements, knee replacements. When you get into the treadmill, they wear a special spandex pants that has a zipper on it. You zip them in. When we turn on the treadmill, it fills up with air. It goes through a little process where it kind of gauges how much the patient weighs. It starts you at 100%, and then from there, we bring them down at that point.
I run track and cross country at St. Brennan, and my knee, I started getting knee pain in like January, so I stopped training and I started coming here. It's been good because I've been able to start running before I can actually get cleared, so it takes like the weight off my body, so it doesn't hurt as much when I run, and I can start running and getting used to like the motions and everything again before I can actually go out and train hard.
When the patient gets in it, usually they're always a little bit apprehensive, but in general, the patients usually like it a lot.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis, and this hour we're getting the 411 on how to get the best looking skin with help from Dr. Ileana Perez Quintaros. She is a dermatologist with Baptist Health South Florida. Well, it is no secret people are doing all they can to beat the clock and fight the signs of aging. And Dr. Perez, I'm sure that is no surprise to you, but there are so many anti-aging products out there today. We see ads for them all the time. And of course, we just want to know, do they work? What can you tell us about all the products that we see each and every day?
That is an enormous subject.
Yeah.
There are some good products out there. What the public needs to understand is that the products that are available over the counter can only do so much. And may make claims that perhaps are a little bit too good to be true.
Okay.
Prescription products, being drugs, can actually achieve an actual change in the chemistry of the skin and the production in the cells of the skin. So you're going to get more from prescription products. I think that's obvious. Mm-hmm. And then we also have another class of products that's between the prescription and the cosmetic products. That class of products called the cosmeceuticals, and those products do achieve some changes that are similar to the prescription medications, but are still over-the-counter strengths. Those are generally sold in physicians' offices.
Okay, I was going to say, so again, when in doubt, it's never a bad idea to talk to your dermatologist about what options do exist for you. And like you said, if it's too good to be true, there's a good chance it might be. But speaking of seeing your physician, I'm just curious, doctor, how many of your patients are coming to you and specifically asking to help kind of beat the clock, as we said, and fight the signs of aging? Is that just a huge part of your practice today?
It is, and it's a very large part of our practice. But we do focus on our general dermatology, sure. And we have a large contingent of patients that are seeking some anti-aging regimens. And products are a big part of that. The skincare regimen is very important. Ancillary procedures such as the fillers, the toxins, the Botox, the Dysport, those types of products, and also the non-invasive procedures, the lasers, the radiofrequency, the ultrasound procedures, ultrasound-based procedures. Those are all excellent also. But our show's, I think, focusing on creams.
Yes, today we're just going to kind of start with, again, the basic kind of base level that you might try. And one of those items, doctor, I think a lot of people have heard the term retinoids as far as what's in a cream, what's in a tube. So let's talk about retinoids and the products that do feature them. What are they, how do they work, and how might they be good for us in the anti-aging fight?
So retinoids, that's an excellent product. The retinoids are actually the one product that has the most evidence, most proof that it actually functions in the anti-aging process. So if a patient comes to me and says, doctor, there's just pick one product for me, there's nothing else I'm going to do other than wash my face and use my sunscreen, give me one anti-aging product, the answer is a retinoid. Huh. And the retinoid that has the most evidence is going to be the prescription retinoid tretinoin. That is the product that really went through the studies and has direct evidence, biological, biopsy-proven evidence that it works. The retinoid family are other products that came from that idea. Milder versions, over-the-counter versions, that may also function in the process of anti-aging. They're not going to be as effective, but they also may not be as irritating. And many times we have to step up patients. We can't start them on a prescription retinoid right away because it can be very irritating. I'm sure many people in our audience have experienced the irritation and the dryness, inflammation that a retinoid can cause. The good news is that skin does build up a tolerance to the retinoid. So over time, with daily use, or at least every other day use, we do build up a tolerance. So we start low and then go pushing the strength as high as we possibly can go.
Okay, you know, and one thing, Doctor, we should point out, I'm wondering too, in your practice, when we talk about anti-aging products, your patients asking you questions, are men also asking these questions, and are these products both for men and women that you're talking about?
So the products, yes, are for men and women. The only products I'd say are not for men are those that contain perhaps a tint in the a tinted moisturizer. But all of the other products can be used by men. The problem is that men in our society really don't use many creams. So we, in our practice, we tend to try to get them to at least use the sunscreen and that retinoid. If we can get them to use the retinoid, they'll at least get some of the anti-aging benefits. But I'll tell you that the largest growing population, population in our office, and I believe across the country, is the male population. They're becoming much more interested in skincare and in the anti-aging process.
They're catching up with us ladies. Yeah. Okay, good to know. Doctor, I want to ask you about one specific area too that's very delicate on our faces, and that's the eye area. So why don't we talk about why it is so important to address that area, particularly maybe after a certain age, and what we need to do to just kind of keep it looking as young as we hope we can.
Yes. So the eye area, yes, is obviously very important because that's where people focus. They look at you. That's the highlight of the face. The eye skin is very sensitive. It's thin. It doesn't have the oil glands that the rest of the skin on the face has, so it tends to dry out a little bit easier. It's also more sensitive. And as we age, of course, like everything, the process of producing the oil on the skin, the sebum, the protective layer, that decreases, unfortunately. So we do have to focus on moisturizing that area a little bit better as we age. And because of the process of aging, the decrease in sebum, and of course the ultraviolet radiation, sun, we get wrinkles. So keeping that area very well moisturized is key. Using a retinoid. Again, we keep coming back to the same three products, the cleansing, the moisturizer, and that retinoid is going to help reverse some of that.
Okay, kind of the trifecta there, it sounds like to me, with the anti-aging. And also, Doctor, we're talking about the cream, you know, other behaviors that we should try to avoid when it comes to the eye. I know I've been told a lot, try not to rub your eyes, you know, do anything that is going to cause extra damage, if you will, to that eye area. Is that correct? So
repetitive motion. So rubbing your eye once, twice, once in a while, that is not going to matter. But if you're a habitual scratcher, rubbing, that kind of thing, or cleansing that eye area a little too roughly, that is going to cause some changes in the skin.
Okay, and also you talked earlier about all the sunscreen options that are available today. The sticks in particular, the gels, are they also particularly good for the delicate eye area, knowing that they're going to kind of stick there, or should we be using a regular cream, sunscreen? What would work best there for the eye area?
So for daily use, no, I wouldn't use the sticks. For if you are going to be sweating, yes, definitely. So if you know you're going to be sweating, running, biking, out on a beach, definitely use the wax sticks. But for daily use, I would use something that's a little bit more moisturizing. So your sunscreen in a cream or a lotion formulation would be best. And even some of the eye creams have some sunscreen in them.
Okay. One thing, Doctor, we kind of talked about, you know, a variety of the products that we can try to use. I do want to ask you though about some people, maybe they go on vacation and they're in a different country and they say, wow, look at this, it's in a cool package, it's claiming to help reduce the signs of aging. Just what would you like to say to people about, you know, being maybe cautious about anything they might see outside of the United States as far as the safety or the efficacy goes?
So I'm sure there's many good products, very efficacious, excellent products available throughout the world, and there are. But just a few products do come to mind. One particular product in the dermatology world is hydroquinone. It's a bleaching agent used for the skin that has been found to not be produced in the same way here in the US versus, for example, in Europe and in Asia. The product hydroquinone has been found to actually be contaminated in those countries because of the high level of production without regulation.
Okay, so basically, doctor, take note, be cautious, and of course, talk to your dermatologist here in the United States before doing anything. Okay, great. We've been learning a lot so far, and coming up, we're going to find out how to deal with some common skin conditions. So stay with us and check out the website allhealthallthetime.com to get questions from all the doctors here. We'll be right back.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with. It's different from a man and from a child, so there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis, and we're learning all about skincare from Dr. Ileana Perez-Quintaros. She is a dermatologist with Baptist Health South Florida. And doctor, we've talked about some of the skincare basics, so now let's turn our attention to some of the skin conditions out there. Now, first of all, mosquito season is just around the corner, unfortunately, and we actually have a viewer question. She wants to know about what she should put on her mosquito bite, so let's see what she has to say.
Hi. I'm Miriam from Miami. I usually get mosquito bites, especially here in Florida, where the climate attracts a lot of mosquitoes. I've tried several creams and it doesn't work, so I was wondering what kind of creams can I use for that? Thank you.
Okay, so what should we be using, doctor?
So the most important thing is going to be prevention. Obviously, covering up the arms and legs that are the most apt to get a mosquito bite, that's going to be key. But if you should get a mosquito bite, try not to scratch. Scratching can certainly increase the opportunity for infection, and you'll end up probably in your doctor's office as a result of that. Over-the-counter products that you can use to decrease the itch, there's some topical anesthetic type agents that contain perhaps menthol or benzocaine. Those are excellent for the mosquito bites. They stop the itch. There are antihistamine type products that decrease the histamine, which is the chemical that causes the itch. So those are all going to be very good. And for most patients, for most people, that's going to be sufficient. Something you can do really quick at home, you have a mosquito bite that's causing a lot of itch, take an ice cube. An ice cube really calms that itch down really, really well. And if you should have more of a reaction, something that's a little more significant, then definitely consult your physician. A dermatologist would be ideal, especially if that mosquito bite is getting a little too red, the red is spreading beyond the area of the mosquito bite, or it's getting hot and tender. That could signify infection.
Okay, and we definitely don't want that. And I'm glad the ice cube trick is actually something you're recommending,
It's
because I do
actually
that
really
a
good.
lot. It does work on a pinch if you need that. Okay, so we talked about mosquito season, again, right around the corner, ways to protect ourselves, and if we get the itch, what we should do about it. But I'd also now kind of want to move to another skin condition, doctor, and that is rosacea. Again, a personal note here, I actually have this. I've had it for a while, but I think it's something that most people don't know about. We have an image here of kind of what it looks like when you aren't, when you have a pretty decent case there of rosacea and without any kind of makeup covering it. So what is rosacea and how common is this among the patients that you are seeing?
Yeah. So rosacea is actually very common.
Yeah.
The picture we just saw is actually one of the forms of rosacea. That is a form of rosacea where you see a lot of the blood vessels on the skin. The other form of rosacea that is very common is also the one that looks a little bit like acne, where you have acne on the cheeks, perhaps in the central face area, and it's also associated with sensitive skin. Rosacea is very common. I would say that we see that on a daily basis several times a day, patient after patient in our office. And rosacea is actually an inflammatory skin condition. We don't know what causes it, but we do know that it is controllable, just not curable.
Exactly, and that's kind of what I've found in the years that I've had it now. And you just said not curable, but controllable. So what are some of the ways that you can manage it, keep it under control? And one important question is, I know stress is a huge trigger probably for this. Yes. So help us out here, doctor. How do you help your patients?
Yes, so first thing, the creams, what we cleanse our skin with, what we use to moisturize, our sunscreen products are going to be very important. They're going to be the basis of what you're going to need to do with rosacea type skin. First, a very, very, very mild cleanser. These products tend to contain calming agents, the moisturizers made for rosacea. And also sunscreen, because rosacea can be worsened by exposure to the sun. So the products are going to be key. There are prescription products that we can also add to that regimen that will decrease inflammation in many different ways. There's a whole host of products that we can use as dermatologists to decrease the inflammation of rosacea, and some oral medications also.
Okay, so it's good to know that it's a common condition, it's not unusual, but there are ways to manage it, and that's always good news for people dealing with any kind of a skin condition. So moving on to another one now is eczema, and the latest figures show this is very, very common, with more than 3 million cases per year in the United States. And doctor, we're looking at an image of what eczema can look like on certain patients. So we're seeing some flakiness there, redness. So tell us again, what are the signs of eczema, and what causes this? Do we know what causes it? Why might people suffer from eczema?
So there's many different causes of eczema. Eczema is actually a very broad category that really just means inflammation in the skin that's causing a dermatitis, a scaling, cracking, an inflamed plaque in the skin. Different types of eczema include atopic dermatitis, for example, which is a type of eczema that affects more the arms, the flexural area of the arms, the bend of the elbows, the bend of the knees. But things just like dry skin can cause an eczema of the legs. You can have eczema of the face. There are many different forms of eczema, and here again, products are going to be very important. You always want to cleanse the body with some type of mild agent, and then always apply a moisturizer to protect the skin, to keep the skin not able to create so much inflammation.
Okay, so basically protection of the skin, and looks like an uncomfortable situation for most patients. And another one of that is psoriasis. We hear a lot about that as well, image of that, and it's seen on the elbow, which I understand is a common area. So again, doctor, obviously different than eczema or other skin conditions. So what is psoriasis, and how can we treat this?
So another form of an inflammatory skin disease, psoriasis, elbow is the most common area. We also see it on the knees, but it can occur whole body, and it can actually be quite a debilitating disease. Psoriasis can also be associated with arthritis, very painful arthritis. That's another one of the inflammatory skin diseases, not curable but controllable. And we have many products, excellent prescription products that can control the psoriasis and control the arthritis of psoriasis. Over the counter, there are some mild corticosteroid type products that can certainly decrease the inflammation, the redness in the skin. And again, you want to cleanse the skin with a mild cleanser and always moisturize, apply that protective layer.
Okay, doctor, you mentioned too there are over-the-counter products, and you mentioned the word corticosteroid, and just again to remind people what that is it just a fancy name for some kind of cream, or what does that mean?
That's hydrocortisone is the most common one used over the counter, and it decreases inflammation. The hydrocortisone is a mild corticosteroid, and that's a relatively safe one to use for these inflammatory conditions. But that's the eczema and the psoriasis we spoke about, not the rosacea.
Right, so always talk to your dermatologist, make sure you know
Definitely.
what you have and what you're treating. And I do also want to ask you, we talked about stress already for the rosacea as a trigger. I'm assuming that stress is kind of a trigger for everything that we've talked about. And what other triggers might exist? Are there certain foods that we might ingest that might aggravate our rosacea or eczema or psoriasis? What other triggers are out there for us?
So there's stress is the big one. That's the one that everyone, and that's a common factor amongst all three of them. For rosacea, it has a lot of triggers. In fact, the triggers are, you can probably fill an entire page of triggers for certain people, but not everyone has the same triggers. So common triggers are going to be alcohol, sunlight, hot spicy foods. Those are going to be very, very common triggers for rosacea, but like I said, there's multiple triggers. Eczema, there seems to be perhaps a link to use of dairy products, but it's not for everyone. Not everyone really responds to diet control with eczema. Psoriasis, not so much, but a healthy diet is recommended for all of these conditions. Healthy diet is always going to put your body with its best foot forward to be able to combat these inflammatory diseases.
Absolutely, balanced diet. I have to ask you, speaking of diet, chocolate, one of my favorite things in the world, by the way, always gets a bad rap. Don't eat chocolate, it causes breakouts. Is that true, doctor? And if it is, I'll deal with it. But I had to ask you while I have you here. I mean, does chocolate really deserve the reputation?
Actually, not necessarily true.
Good.
There are some diet restrictions, some diet connections, let's say, for example, with acne. We used to say no, not many at all, but we have recently found that high glycemic diets, that means diets that are high in carbohydrates, may be linked to higher incidences of acne. And that's a difficult one for the American public with our high carbohydrate diets and our love of French fries, but that is a pretty established link nowadays.
Okay, and one thing to mention too, doctor, it's important if anyone watching thinks they may be suffering from any of the skin conditions that we've discussed today, they can affect your quality of life. So I guess also just stress the importance of you don't have to suffer in silence if these are bothering you. To speak to a physician, to speak to a dermatologist, correct? Because there are ways to manage all of these conditions.
Oh yes, all of these conditions, everything we spoke about and many others are controllable. There are very good medications and products out there, and controllable to the point that there's no sign of them. There are patients that have more difficulties and require a little more support, but they are, for the most part, in most cases, very controllable.
Okay, that is good news. Again, we like to end things on a happy note.
Definitely.
So we've heard about the skin conditions, we've heard about some basic skincare, and we still have more coming up as we wrap things up on this hour. We're going to learn how healthy daily habits can do wonders for your skin. In the meantime, please be sure to visit our website, allhealthallthetime.com. You can submit your questions for Dr. Perez and the other doctors here and find out about a whole slew of health topics. Stay with us. We're going to be right back here on South Florida PBS.
Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Ask questions about how to correctly take your medicine and why you need it. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Intoing is basically when your child comes in and walks with their feet pointing towards the midline. Most people walk with feet out about 10 degrees, pigeon toes with the foot inside. Intoing is very common. It's by far one of the most common reasons for us to see patients in the office. But most pediatricians do a very good job at telling you if there's something more that needs to be done. It can come from 3 different places. It can come from your thigh bone, your tibia, or your foot. And any one of those things can be curved to cause the foot to progress forward. We now know that this condition improves on its own. It doesn't cause any lasting issues, no arthritis, no other joint issues or bony issues. And the bracing can actually cause weakness that can maybe even delay the progress of them getting better on their own. More than 90% of these kids will outgrow this, absolutely.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
Hello, I'm Dr. Jose Sosa with Baptist Health Primary Care. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least 2 of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Welcome back to the Health Channel, all health, all the time. I'm Laura DeAngelis. We are winding down this hour on dermatology with Dr. Ileana Perez Quintaros. She is a dermatologist with Baptist Health South Florida. And Dr. Perez, we've been talking about some of the rituals and the products that can help keep our skin looking its best. But now let's go beyond the jars and the tubes of the lotion and let's kind of head to our fridge because nutrition, let's talk about how that plays a role in promoting healthy skin.
So nutrition is going to be important for just about everything, and of course skin is included in that comment. healthy eating habits, protein is very important for the skin, good fats are very important for the skin, certain vitamins can be also appropriate for skin health. And to give you a few specifics, protein, for example, very, very important for hair. We know that if you, for example, go on a diet and you are protein and calorie deprived, approximately 3 months later you might find your hair shedding. So hair being a part of the skin, very important. Also, the fats and lipids are part of your cell membranes. So keeping a good level of fats in your diet, very important. And then certain vitamins are important for the skin. The vitamin A, vitamin C, vitamin E, the carotenoids, those are all listed as very important parts of a good diet for skin health.
Okay, and when we talk about those healthy fats that you just mentioned, we can find those in things maybe like an avocado, right? That's a good, and also almonds also have antioxidants and some of that healthy fat that we're talking about.
All of those, yes, certainly.
Okay, and any fruits and vegetables that are known? You know, we hear a lot about superfoods these days, and I know the word is thrown around a lot, but any fruits and vegetables also that might have a little positive effect on some of that shine?
So definitely those that contain vitamin C, citrus fruits are going to be good for the skin. Vitamin E type products and the carotenoids, carrots and some of the vegetables that contain the carotenoids are going to be key. But some of these are some orally ingested are good, and some topically applied are also beneficial. So vitamin C, for example, is a good antioxidant applied topically. Vitamin E, topically not so good, more the oral version of that one is much better. And the carotenoids, we want the oral version.
Okay, and we do see, you mentioned the vitamin E, we see the tablets, the supplements, if you will, in the stores, and there's also the oil. And again, yes, it's not necessarily something you want to rub on your face because it is oily, but when can just kind of a little bit of that help maybe a certain, either a patch or another condition that you might want to treat with something a little thicker than just a regular moisturizing cream?
So vitamin E actually added to a moisturizer, probably not. So it's more. It functions a little bit more as a moisturizer.
Okay.
Orally, it can function as an antioxidant, but as an addition to the topical products, it may help the vitamin C a bit, but it really functions more as a moisturizer.
Okay, that's good to know. Now, while we're staying on kind of what we're putting into our system, let's also talk about hydration. Water obviously is essential to life, so remind us again about staying properly hydrated. What does that mean? Like, how much water do we need? And notice I'm talking water. I'm not talking any kind of other beverages out there.
Water is very important, again, for the entire body. For your general health, water is going to be important. But water is not all that you need. So you can drink water, your skin is hydrated, but you also need to seal it in. So that's where the moisturizers are going to come into play. You can drink the water, the skin does absorb it, but you need to seal it in.
Okay, that's a good thing to know, that the water and the moisturizer kind of work together.
They work together.
They're a team.
Yes.
And speaking of a team, one thing I'm always promoting is the fact that if you're eating well, you're taking the time to eat well, you're having your water, you're sealing it with the moisturizer, you're also going to want to exercise, right? Because they kind of go hand in hand to make sure that you really are doing all you can to feel your best on a given basis. So what is it too about exercise as it pertains to having a healthy glow about you or just good looking skin?
So exercise, again, another one of those things that's just good for general health. Exercise also dilates capillaries, gives you that dilates the blood vessels in the skin. So can give you that glow, that little bit of that little pinkness that makes us look alive. And then exercise also reduces the stress levels, and stress triggers a lot of those stress-induced hormones that can have a very negative effect on the skin. So exercise very important for skin health by reducing, for example, cortisol levels.
Right, and as you said, stress being a big factor in things like we discussed, rosacea, eczema, psoriasis. So again, go out there and exercise. You're going to probably feel better and look a little better because of it too, which is great. finishing kind of the puzzle that I like to call in the healthy living puzzle, a missing piece for a lot of people tends to be sleep or rest. And I know it's very hard in our busy lives to really get the rest we need, but again, doctor, just a word of encouragement to try to get the rest because, again,
Yes.
another benefit for our skin, correct?
Yes, and also related to stress. So if we don't sleep enough, increases the stress levels, increases those hormones that also affect the skin, and it's also going to not allow the skin to regenerate. The most regeneration of our skin and healing processes occur at night. So if you don't get enough sleep, the skin doesn't have a chance to really recover correctly from the daily stressors that it encounters throughout the day.
Okay, so we need to try to get more sleep is the bottom line there.
Yes.
Doctor, a couple of other general questions, and I think people are always wondering about this. Let's just ask the question about facials. Good thing, bad thing, in between. What is your take on that? And specifically, I'm thinking about people with sensitive skin issues. Again, I have rosacea. I always shy away from facials, but maybe I shouldn't. I don't know. What's your take on that?
And you shouldn't. The more important point here would be to make sure that you're with a provider, an esthetician that is familiar with the facials appropriate for patients with sensitive skin. Okay. That would be, that can be perhaps a little difficult for the consumer, but I would advise the public perhaps to check with their dermatologist and to check the credentials of the esthetician if it's outside of a dermatologist office. A certified esthetician should know how to do a proper sensitive skin facial.
Okay.
And they are good. To address the other question, I almost forgot that one. Facials, yes, I do. I love facials. They do clean the skin. They provide a healthy glow for the skin, and they're relaxing. Again, reducing the stress level. We keep coming back to that topic. Yeah.
Well, unfortunately, it's a really big part of most of our lives, and I think finding ways to eliminate it is never a bad thing. And that being said, so a facial might be a great way to kind of get a little bit of stress reduction. Any other techniques or practices that you might encourage people to consider, also to kind of remove the stress, help us look our best, feel our best, whether it be a massage or just other activities that you might encourage to feel good?
So anything as far as well-being, any techniques that make you feel good, massages, yoga, the exercise, meditation type techniques, all of that is going to create a positive environment for your body and of course for your skin.
Okay, positivity is always a good thing, and smiling is just makes you feel good too, so we have to remember that. Doctor, as we start to kind of wind things down, let's just remind people of a few of the basics that we covered throughout this hour talking about skincare. So remind us again, the essentials, whether you're a man, you're a woman, whatever your age is, what essentials do each of us need every day for good skincare? So
basics, cleansing the skin, moisturizing the skin, and using your sunscreen. Sunscreen on a daily basis, minimum of an SPF 30. Reapplying your sunscreen if you're going to be out and about, especially if you're going to be exposed to the sun and sweating. Different types of sunscreens can be utilized for whatever activity you're going to be participating in. Remember the wax sticks, the spray sunscreens. You also have the makeup sunscreens and the powdered sunscreens that you can apply on top of makeup. So protecting yourself from the sun. Getting your vitamin D levels, you'll get enough if you're just out and about.
Especially here in the Sunshine State.
Definitely.
I don't think it's too hard to get your vitamin D. Also, just quickly on the cleanser, again, what to look for, and particularly if you have a different skin condition, what's going to work best for you?
So cleansers, look for mild ones, things that don't strip the skin, unless you have oily skin and you do need something that is going to be a little bit more aggressive. Men also need the cleansing, the moisturizer, and the sunscreen.
Okay, so the men, as we said, they're starting to catch up with what we women have been doing for a while, but it's good to remind them as well. And just also, Doctor, we did spend some time too talking about the anti-aging products that are out there. There are so many, we are bombarded. Again, just a word to manage people's expectations about what they might be seeing and how effective they really might be.
So the anti-aging, there's a lot of things to pick from. The anti-aging products include DNA repair, antioxidants, retinoids, all kinds of agents, and it's hard to pick from those.
Right.
But the essentials are going to include the cleansing, the sunscreen, the moisturizer, and then for anti-aging purposes, the retinoids. That would be the one ingredient that I would add to that if a patient is interested in anti-aging.
Okay, so again, you talked about your cleanser, your sunscreen, your moisturizer. We're going to drink our water. We're going to eat a balanced diet. We're going to try to exercise. And again, you're going to talk to a physician if you have any specific questions or skin conditions, because everything out there is manageable, right?
Yes. Yes. Most things are manageable, controllable.
Okay, and any last message you just want to leave with people about, feeling good at any age and putting their best face forward?
Yes, so do things that make you feel good. Stay positive, exercise, stay hydrated, and protect yourself from the sun.
I love it, doctor. Do things that make you feel good. I can't think of a better way to wrap this up. Thank you so much for joining us today. It was great having you here.
Thank you. Thank you very much for having me.
Sure. And that is all the time we have for now. We thank you for watching the Health Channel, All Health All the Time. And don't forget to check out our website, allhealthallthetime.com, to submit your questions and learn all about what the programming is here on the Health Channel on South Florida PBS. I'm Laura DeAngelis. See you next time.